Hi, good morning, everyone. My name is Dr. Milad Kashani, and I work at Foot and Ankle Center of Washington. Today, I would like to talk about this paper. In general, as physicians, we like to incorporate research in our day-to-day practice to provide patient with the best evidence that we have and practice evidence-based medicine so that we can help them make the best decisions. Um, Today, we want to talk about mid-portion Achilles tendonitis. This is actually a fairly common problem that we see uh, with all of our patients from all different age groups. Uh, One thing to mention is that typically people with, tight Achilles tendon or really active tend to have these mid-portion Achilles pains. So when we see our patients, typically we start them on, stretching exercises and a group of exercises called eccentric strengthening exercises. In addition to that, the other thing that we do basically recommend is shockwave therapy. But let's just look at this paper and see what the evidence says about shockwave. Now, whatever treatment that you're looking for out there, there are definitely evidence for and there are evidence against it. So this is just one paper in a different group of papers that are out there. So I'm just going over this. In future sessions. I'm going to go over a different set of papers as well. But let's look at this paper. This paper was published in Foot and Ankle International Journal in 2021. This paper is actually out from Egypt. Um, I like this paper because it's a level one paper. What that means is that they actually had two groups that one of them got, in conventional treatment, eccentric strengthening. The other group got eccentric strengthening exercise in addition to shockwave. And, you know, the subjects did not know which group they were in. So it's a double-blinded study. Even people who were doing it did not know that. So that's typically a better way to do this research because then we are not dealing with any placebo effect, and we can compare two groups at the end and see how they're doing, and then we get our results from them. Now, uh, let's look at the way they did this paper in general. So they had 50 subjects, I believe, around 28 or 22 male and 28 female patients, age 18 to 40 years, and they basically put them in two different groups. One group got eccentric strengthening and stretching exercises. The other group got eccentric strengthening exercises and stretching exercises in addition to shockwave. Um, and then they followed up these patients to see how they do. They followed them up at 4 weeks and the minimum of 13 months. Um, I definitely encourage you to get this paper. If you come and visit us, we can provide you with papers and different papers that we have for evidence. But long story short, when they actually looked at the results, both groups did pretty well. Both of them showed improvement at their short and intermediate term follow up. But what we know, and this is, I guess, better to go to the conclusion part and see that, is that, you know, although both groups had significant improvement, adding shockwave therapy to it resulted in a significantly greater improvement in different scores that they were looking at. So they looked at pain and they looked at function. And they noticed that the group that got shockwave did better on both fronts than the group that just did eccentric and did stretching exercises. And that's typically what I tell my patients. I usually tell them, hey, we usually start with we usually start with eccentric strengthening. We definitely work with stretching exercises, but shockwave can have some added effect to get you, out of this problem. So that's something to consider, and that's why we do offer shockwave in addition to the exercises for patients. So I will see you back for another session. We're gonna go over different papers for different problems. But I think this is a good start. If you have any questions, you can reach out to us and then make an appointment to see us for this problem. Thank you.